Caroline Juguna, and this is Afya Buzz. Today, I'm joined by Dr. Edwin Rono, who is a craniofacial surgeon, and we will be discussing cleft lip and cleft palate. Welcome, Dr.
Thank you so much, Dr. Njuguna.
It's really nice to have you.
Yeah, nice to see you again after a long time.
Thank you,
Yeah.
Doc. So, Doc, you can start by telling us when we talk about cleft lip and cleft palate, what does that mean? And what's the difference between cleft lip and cleft palate?
Good. Cleft lip in itself is where the upper lip or even the lower lip, which is very uncommon, is parted and not joined well during formation in the womb. And they have been called hair lip or whatever by many people in the society. Then the palate is where inside the mouth, the roof of the mouth is not joined well during formation again in the womb. So the palate is inside is one that usually one doesn't see very well, but the one on the lip is on the face that usually manifests very much, and parents sometimes find it difficult to show their children out in the open.
And what causes this defects, Doc?
Oh, well, they are genetic, first of all. There are condition symptoms that would cause that, and there are environment factors that would predispose to this. And there are literature written about this. Some literature say use of firewood, maybe use of medicines during birth. Some of them will predispose you to these conditions. Yeah.
Does smoking and alcohol maybe cause a risk?
Yes, they are usually those who, because in the mother, when they are taking them during before, during the time of conception or just before conception, of course, that would put you to some risk of causing some congenital problems.
When most of the time do we make this diagnosis? Is it before delivery or is it after delivery?
If you have, if you've been attending clinics and being seen by a gynecologist, a obstetrician and a gynecologist, they will be able to diagnose this if they do some tests like ultrasounds of the abdomen. At a certain time, they'll be able to tell. And I've seen some patients being referred to us where the doctor has seen that the patient has some deformity of the face. It can also be done just immediately after birth, and the pediatrician usually, when they receive the baby and they look through the baby, they may be able to diagnose this. Other times, because of obviously lack of experts, they may go through without being diagnosed. Yeah.
When it's diagnosed before delivery,
yes,
is there anything that can be done, or we just wait for the baby to be born and then we think about correcting that?
Once the cleft has formed, it becomes difficult now to repair it intrauterine, that is when it's in the womb. And it is, the literature says it can be done. I have not done it myself. But those who have tried, one of the complications they have is that the spontaneous birth, and that maybe has already abortion, which has now hindered that kind of development. Again, the cleft surgery is so delicate, and the babies, when they are still young and in the womb, the tissues are not so well formed, so it becomes difficult, challenging to be able to put this together. If you put these tissues together and you make slight errors, and this error, if you make them in millimeters, as the child grows, becomes more expounded. So it's best if the child is done at a certain point in life. Once you have been, the baby has been delivered, we give it time also, because we normally do this under general anesthesia, which means the baby is put to sleep using chemicals that might be harmful when they're still young, and we want the tissues to have developed to a point where even the surgeon can be able to identify the tissues. Well-developed tissues allows the surgeon now to be able to repair it accurately. So when you repair it too early, you are not able to get a lot of tissues. They are not very well developed. Secondly, for the risk of the baby. Anything going awry at the early stages, it is easily manifested and can throw the patient into the other end. So for safety, we have decided that we should operate maybe at 3 months or 5 months, depending on how healthy the patient is. I have been able to operate even 24-hour-old patients.
Okay.
It's not impossible, but to optimize on the surgery, you would prefer if this patient was a bit older. Yeah, that is for the lip. And the palate even then becomes more difficult because again we have a problem with bleeding in the operation table. There is much more bleeding when you are doing the operation with the palate as opposed to the one when you are doing it in the lip. So again, that compounded with other factors makes us want to operate on children who are much more healthier. It is also attendant with risks of breathing and feeding. So we want patients who are much more grown. So we give it at older age, up to about 1 year. Yeah, we can operate with them.
Okay.
Yeah.
So for cleft lip, it's better between 3 and 5 months.
About that time, yes, good. Even older, but that is at least a starting off point. And the palate would be much more older than 5 months, going towards 6 months, etc. Yes.
Okay. And in theater, are there any risks? I know you have mentioned about bleeding.
Yes.
What are the other possible things or risks that could go wrong in theater, and how do we prevent that?
Okay, thank you for that. First of all, every time you take a patient in theater, we are always mindful that anything can go wrong. I mean, even in the finest and the fittest person, once in maybe a blue moon, suddenly they react to one drug or another, or they have uncommon complications like malignant hyperthermia. Now, that is one. Number two, for them being children, like I said, there's where you lose volume in blood loss, their body does not react, recover or compensate as well as if they're older. Of course, they also risk infection, like all the surgical conditions. You are likely to get post-operative complications. Now, the children, we give them good anesthesia. And we even after the operation, during the operations, we give them local anesthesia, which is numbing medications to the lip and the palate. And often, because they don't feel pain after the operation, they sometimes even bite their own lips and then do the work we have done. Yeah, they are not feeling the pain, so they are either biting it and they go back to eating normally as if there's nothing, and that might put some trauma to the area and open up. So rarely we do, but they are there. We are aware of that. We try to advise parents that after the operation, please don't feed the child, especially for the palate. Don't give them hard food. Let's go on the soft diet. Yeah. So it is possible that you've done a good job, and then because of ignorance, the baby can open up again. So it is once in a while again. A few cases I've seen where the child has opened up the stitches. Yeah.
When it comes to surgery, is there time where after someone comes, you feel like this is too late, or it's never too late?
Well, to be honest, it's never too late. I want to tell you, for the reasons we operate, we have to be sure that when you're operating, we want to get the maximum benefit. Otherwise, placing the patient to this anesthetic and surgical risk is not worth it if there's not going to be any benefit. Now, I have seen when we started this program, we did one mission in Meru, and that was maybe 2003. And our first patient, I remember, was the eldest, was a 53-year-old man.
Wow.
And he had a cleft lip, and this poor man didn't have a wife, and it seemed to be a bit fallen. then we did the operation for him, the lip, and it came out very nice, very well. And the next year, he surprised us that he has now got a wife.
Because now he's looking good, the face has changed.
And it is now acceptable to society.
Yeah.
So there is no age limit. The question is, we don't want to extremes also. I don't know, I've never seen anybody maybe 8 years old, but it would be, there's nothing stopping us from doing it. The problem comes with the palate. In sometimes when you are trying to correct the palate in elder people, it doesn't give you the benefit so much, especially if you are looking to recover speech, to rehabilitate with the speech wise. The speech is usually difficult to get after that.
Yeah.
You can do it, but it will be more psychological benefit to the patient. And by that time, they are already feeding. That's why they are what they are at that end. So they are not having difficulties feeding. They are able to feed. So, like I said, now what benefit are you looking to give them, other than that feeling that something has been done, psychological feeling. And so there are times when we have opted to use what is called an obturator to be able to close that gap. But again, that is just maybe to allow for better feeding, and speech. But you don't get much benefit.
So, and I'm imagining these people who are coming late, it's maybe because they didn't know that there's actually an option of treatment. How informed are people from your experience, our general population, how informed are they about the option of cleft lip and cleft palate surgery?
I tell you this, when we first started out, like I told you, the age group was much older, and we're getting patients, like I told you, about this 53-year-old man. But now it's younger and younger people to the point where they are presenting even, like one case I was telling you, where the doctor approaches me with the ultrasound of a baby who's yet to be born. So people are getting more and more aware. And facilities are getting closer to the people who require it. So it's becoming easier for people to get access to this and even knowledge. Again, you see, it starts with the first contact with the gynecologist. Again, this one is, the people are looking out for these malformations, external malformations in children or even babies, long before they get in contact with the surgeons.
True. Oh, and now when people don't get treated, what are the challenges that they face? I know you mentioned about the speech when you're talking about the 53-year-old person.
Yes.
And the appearance and all that. What other challenges do they face?
Well, I'll tell you, first of all, some of them don't even get to us because in the community, some people think that this is, they have been bewitched. There have been harrowing stories about mothers being ostracized by the community because you are bad luck, you are the one who's caused this. The very disheartening, I can tell you, when this happened. Like I said, psychological, social stigmata on those families is so much that they are not able to partake in usual community activity. There's this lady I remember vividly in DRC that who had brought a baby who had a cleft lip, one that was on the sides, what is called Tessia 7. And she was quiet, and when we did that screening, like we are doing today, we didn't think that we would do it at first. And she was a bit, I could see a bit concerned. Later on, we managed to do it, and after that, she was so jubilant that she told us that now the first thing I'm going to do is go to church and give praise to God, because now I can bring out my child into the open. That when I gave up my birth to this child, I was not able to show my child outside, whereas my neighbors were always showing off the new baby. Everybody is coming to admire, and for her it was something which now brought out very poignantly to us that this really is good for them. I mean, it does help to heal some community social aspect of their lives.
So this lady was hiding the baby all their life.
Oh,
before
they
the
did
surgery.
want to show them, they would cover them if they had to travel out. And in the African tradition now, people want to show out that they have got a new baby, and this is how people come and coo and talk and say, look at baby. But here you have a baby who has got malformation, and only the parents who can be able to maybe take care of the baby without giving bad feeling or saying bad about the child. Yeah.
Wow.
So this one I can tell you, I saw over the years that whenever children are healed, the parents are so happy, very jubilant. Some of them break down in tears and they go home feeling happy. And they are now even enthusiastic to have the child being again going to school and things like that.
Wow.
Yeah.
So beyond the physical healing, there is also emotional healing for the person affected and even their family and caregivers.
Yes, it does. It does. Well, you can imagine how the child would be among other children in school, how it will be. So if they're all confident and how they catch up with the rest, it will be affected. Yeah.
And they also become subjects of bullying because they look different.
Yes, they may get bullying, but even sometimes being the people, they remove themselves from you, you're all left alone where there's playground, things like that. Yes.
Wow.
Yeah.
Thank you, Doc. As we finish, what message of hope can you give a parent out there whose child has been diagnosed with cleft lip or cleft palate, and they are thinking about surgery and they are really not sure? What message of hope would you want to give them?
We have come a long way. See, first of all, I'll tell you, in the craniofacial region, cleft lip is the second commonest, or maybe the commonest malformation. And there are so many of them, maybe almost 1 in 700 to 1 in 2,000 life births would be having that. So if you're talking about a population of 50 million, that was saying 1 in 200, you can see the percentage of people who are likely to be born with this thing, cleft lip and palate. So it's common. And the people should not feel that this is only me. It's so common. I have seen doctors too who had cleft lip before, and they've been prepared, and now they are part of the doctors. I've seen that in Europe, and I've seen it here in Kenya. So it is one, they should not feel that this is something extraordinary. It is a thing that happens in most people. It's a genetic thing that happens. Is a part of disease like any other disease. Okay. And secondly, like I said, I've seen doctors who have had good repair and they look well. And I've seen my parents, children whom I treated many years ago, and they look so well now. So it is possible for this to be repaired. And it is nothing to do with those people, what the people have been putting out saying is witchcraft. It's you this and that. It is only a medical issue, like growing a 6 finger in some people. It's a normal thing. It is very common, very common.
Okay. For women who are pregnant or thinking of getting pregnant, is there anything they can do to reduce the risk?
First of all, yes. If you are already, you need to keep yourself with the good habits. You avoid abuse of alcohol, drugs, and use what doctor prescribes for you. Number one, of course, keeping fit for everybody. It's not only for the ladies. For every one of us, it's good to exercise well, eating well, and some of this advice you can get if you are following up with the doctors. Let's not see doctors when things are going apart, but maybe frequently, maybe after a year, for some who think they're healthy, every 1 year you visit a doctor and he gives you a thorough going over. That's one. Then I know that if they're given good supplements, if they're examined well and they're found to have any nutrients missing or elements missing in their system, they can be given supplements by doctors.
Yeah.
They can be, and this helps out. Folate, for example, it helps out if this would have been shown to decrease the number of cleft lip, where they have mothers have been given supplements for what they need, not when it's not supplement for the sake of it, but if there's some deficiency, yes, they can be corrected in good time. So avoiding abuse of substances, and then taking care of yourself with what everybody by now should know: exercise and eating well. Yeah, and the supplements are not. On the other end is people overdoing it again, taking supplements for what they really don't need. And I've seen this. You can see in our society. Every new thing comes out, people take it up, and they take so much there. You have started with if you remember, quail eggs.
Yes.
People did take that, and then this comes, people take it up. And that's why I say maybe it's the best. Not maybe, it's usually best if you go to a qualified doctor and it gives you advice to what you need. Otherwise, you may end up overdoing things.
Yes,
and that can also be a problem. So it's best for people to take care of themselves, eating the right stuff, exercising right, and having a regular appointment with the doctors. Yes, it is not possible to stop completely. All some of them are acts of God. You have got genetic things which are transmitted from your other family. Again, you cannot stop genetic. Yeah.
Wow. Thank you so much, Doc. And finally, I know you're volunteering with Operation Smile.
Yes.
Why are you volunteering with Operation Smile? What drove you to that, and how has that changed your outlook in this area of cleft lip and cleft surgery?
Well, to be honest, I just, when I first started off, having trained in Europe, I came back to find this was being taken up mostly at Kenyatta National Hospital. And being a maxillofacial, I was requested if I could join, and I did. That's maybe 23 years ago, so 24. So from then, I found passion in it because it gives you so much joy. To be honest, where you are not rewarded financially, but you are rewarded by what you see at the end of it. Yeah, and that nothing can really take away that joy from you or give you more joy than to see you giving. So somebody who does not have to appreciate you back in return, because children don't even know who is repairing them. Yeah. But the parents, wow, you should see the faces when you see the children. In fact, there are some cases where parents have said, no, this is not my child. You must give me my child. Yeah,
they look very different.
No, you. That has happened before. Yeah, they don't think, they say, no, this is not my child, because it is coming out nice, and they think that, no, the other child, they cannot believe that this is possible for them to be repaired.
Wow. That must be very satisfying.
Very good. I can tell you, it's a very nice feeling.
Wow.
Yeah, it's a very nice feeling.
Keep up the good work, Doc.
Oh, thank you.
Continue touching the lives and, making them smile more.
Yes.
And may God bless you for the good work you're doing.
Oh, he has already blessed us. Even that joy in giving us the skill and the opportunity in itself is a joy to us.
Wow.
Yeah.